so we can measure your resting heart rate, right? We can know how to measure it. Put your hand out like this, put the other hand under it, and put your fingers on the artery right there. Everybody find their heart rate. I got it? Okay, and so do that for 10 seconds. Multiply what? Times 6. Okay, and so the first beat is 0, not 1, because you start at what? You start at 0, you don't start at 1. Okay, and so then you can take, feel it, and then who's got a stopwatch? Okay, got a stopwatch? Say go, we'll do it for a minute. Count a heart rate. Start. That was for how long? Huh? I don't know how long you went. Oh, you went 15 seconds. Okay. Okay, it makes sense. Okay, so you can multiply that times 4, right? And that'll give you about what your resting heart rate was. It tends to be, do it in the morning when you wake up, and then that'll give you a more accurate heart rate there in terms of what it is when you're actually resting. So you're probably stressed out right now, right?
I think mine goes up every time I try to test it.
Well, if you push too hard on the artery, it makes it go up because the heart's trying to get the blood through underneath your fingers.
Mm-hmm.
That's why if you push on your carotid artery, it makes your blood pressure go up. So you have to be careful in terms of how hard you push it. Okay, so we got Sally here. We got our resting heart rate, we got our max heart rate. We want to know what our heart rate reserve is. Heart rate reserve is the difference between max and rest, right? So it's 200 minus 70, so what is that, 130? So our heart rate reserve is 130. So our heart rate can't go lower than rest, right? Can go 0, but normally it should go lower than rest, right? And it should go higher than what? Max, right? Okay. And we can predict it, 220 minus the age, but that is not very accurate. The error is about plus or minus 12 beats per minute. And there's other formulas that are better. So as an exercise scientist, you would want to measure their max heart rate, right? How would you do that? You have to put them on a treadmill, or you have to run them, or you have to do something and see what their maximal heart rate is, right? You can predict it, but if the standard error is plus or minus 12, that means in some people it's going to be, 212 or 188. Some others it may be, 230. 170 or 60 or whatever, and so forth. But normally, just for predictive purposes, 220 minus the age. So since I'm older than you, my max heart rate should be what? Should be lower. It's about 155, 160 is what it is. But and the 220 minus age isn't a very good formative for some people, but we can predict. Women's heart rates tend to be higher, right? Your heart rate is the highest in your life when? Huh? You're close. When a baby's born, right? Because a baby, think how little bitty heart they have. And that little bitty heart has to do what? Has to beat fast, right? To pump the blood. Okay. And then as you mature, your heart gets bigger. And then your resting heart rate does what? Slows down a little bit, right? Okay. So that's what happens. let's say for light exercise. 30%, right? 30% of heart rate reserve. So how do we calculate that? So we take 30% of 130. So what is that? 30% of 130. Equal 39. And then, what do we have to do? Add back in what? The resting level, right? So it's plus 70 equals what, 109? So her heart rate at 30% of heart rate reserve would be what? 109, right? Okay. And so that's pretty low, right? And so if we just did a percent of max heart rate, that may be what her heart rate was. But that'd be pretty low. And so we can say 30 to 40%. And so if we did 40% of heart rate reserve would be 40%, that'd be 52 plus 70 would be 122. 40% equals 122. So if we wanted her to do light exercise, we would recommend a heart rate or an intensity between 109 and 122, correct? So if the heart rate got higher than that, based upon heart rate, we say, okay, you can exercise your heart up to about this, okay? And then for light, and then if we go to moderate exercise, did the calculations, moderate equals 122 to 148. So moderate equals 122 to 148. Okay? And so that's 40 to 60% of heart rate reserve. So then, and we could look at the med levels. Then we could look on our chart and see what med level that is, and we could look in terms of what heart rate that is, and then that would give us an indication of what? The intensity that the person should work at, right? Some things may be too hard, some things may be too intense, right? And some things may be appropriate for that particular person. Now these are for adults, not athletes, just adults. And then vigorous exercise would be greater than 6 MEPS, that'd be greater than 60% of heart rate reserve. That would be greater than 6 MEPS. Everybody understand that? That's the way we do heart rate prescriptions for exercise. Makes sense? Based upon what? Heart rate reserve. It's also based upon VO2 reserve. What kind of problem would you have using VO2 reserve? Go wake up. Mackenzie, what kind of problem would you have using VO2 reserve? No. Okay, if I said, Mackenzie, I want you to measure my VO2, how would you do that? Okay, do you have a treadmill at your house? Can I come over to your house and you can do my VO2 reserve? No, you have to find a university with a treadmill with an oxygen system in order to do that. And so that would probably, let me see. I don't know if Alabama State is. I think the PP program has a system that'll do that. I don't think their exercise science program has that. We're probably the only place in town that you can get that done unless you went to a hospital that actually did that. Not many hospitals do it either. So you're pretty limited. Somebody sent me something the other day, wanted to have it done on somebody, and with this COVID stuff, we're not doing much of that now, but we've done lots of them. But if you're gonna have a hard time measuring my VO2, I can predict it, about doing the patient test or doing something else, but you're not gonna have a simple time doing that. We can do a bite test and predict it with some actual things, what is a YMCA test that we could use or whatever. So we can predict it, and come up with some numbers. Let me show you something. What we do, this is common in exercise science. We can plot. We can take a plot, like so. We can put heart rate over here. This heart rate over here. And then we can take med levels. 3, 6, 9 meds. This would be 302, 5, 5. Then we can do okay. So we have a graph, and this would be meds. This would be other. Okay. Did y'all see that? You see that from over there? So this is the graph that we can develop. And what do you notice about heart rate and VO2? What do you notice? Okay, the higher the heart rate, the higher the VO2. And what kind of relationship would we call that?
Directly
Linear,
proportional.
right? Linear means what? Straight line, right? And so it's a linear relationship. So if we know heart rate, we can predict what? VO2, right? And so if we know heart rate, we can predict VO2. So that's why in your book, they've got exercise intensity, shows it down here, based on heart rate reserve, VO2 reserve, MET levels, and so forth. So if we know, yeah.
How would you go about finding that heart rate for somebody being over if you wouldn't be able to like actually measure that heart rate?
No, that's why you have to predict it.
There's no surefire way of being able to tell somebody's actual heart rate.
Not unless you did a max test on them. And then if you're taking beta blockers or taking some kind of cardiovascular drug, it changes it, maybe make it a lot lower. So if you're taking beta blocker drugs, then you have to test them on beta blocker drugs and see what it is. So, and that'll make it 20, 30 beats lower than what normal heart rates are. So we have, some things we have to predict. Make sense? That's predicting some things. And so on. But here, if we know one variable, we can predict another variable. And we can do pretty good, right? And so remember, everything's not an exact science. We're just trying to get some information there. Okay. So where we at? So here, no exercise. We've got an exercise prescription, light to moderate intensity recommended, may gradually progress to vigorous intensity exercise following ACSM guidelines. That's the person that does not exercise, they have no cardiovascular disease, they don't need medical clearance, and now they're just starting out what? They're just starting out with an exercise program, right? Okay, and so that's good. We can get them going. And so we can come up with a lot of things that we can do there. Okay, then the next one, they have known cardiovascular, metabolic, or renal disease. and they're asymptomatic. This would be somebody that maybe has diabetes, right? Or they know they have heart disease, well, they have no symptoms. Okay, they know they have heart disease, but they have no symptoms. So they have heart disease, but they don't have chest pain and so forth. Medical clearance is recommended. So if that person comes along, you would recommend what? They go check with a physician, right? Okay. And then following medical clearance, light to moderate exercise is recommended, and then they may progress as follows. Then the next one is any signs or symptoms suggestive of cardiovascular, metabolic, or renal disease, regardless of disease status. So if they have signs or symptoms, if somebody's coming to you that's having chest pain, what do? You get them to the doctor right away. I had a guy that came in, we were doing a VO2 test, and instead of going to his doctor, he comes to me because we were doing these for runners and we were doing them really cheap, max treadmill test. And so I get him on the treadmill, he's having chest pain on the treadmill, having a heart attack on the stinking treadmill with me in the room with him, and he could have died, okay? And so if I'd known that, I never would have tested him, right? And so he said he's a runner and he did all this junk, but he lied the whole time. He just wanted to get a stress test for about $100. And so you have to be careful of that. Okay, then we got people that exercise. Okay, and so no cardiovascular, metabolic, or renal disease, no signs or symptoms. Medical clearance is not necessary. Continue moderate or vigorous exercise. So put them out there and let them go, right? So that'd be most of you in this classroom, right? You exercise regularly, you don't have any signs or symptoms of heart disease or whatever. We can put you out there and we can do some 5Ks and we can run and race and play soccer and whatever, right? Yeah. And so a lot of opportunities for that group. Then known cardiovascular, metabolic, or renal disease and asymptomatic. Medical clearance for moderate intensity, not necessarily medical clearance, okay? Within the past 12 months, and no change in signs or symptoms recommended for. Recommended for they start vigorous exercise, continue with a moderate, and so forth. Then, signs or symptoms suggesting cardiovascular, metabolic, and renal disease, regardless of disease status, discontinue exercise and seek medical clearance. So if somebody on your soccer team's having chest pain, you need to do what? Get them to the doctor, right? Okay. So you understand this chart right here? Okay. And so let's take a quick break, and then we'll come back and do